Hello students, you are welcome to another study session of this module, which is study session 12, and it will focus on health assessment. In the previous study session, we have discussed the nursing process, which has 5 phases, and assessment of the client is the first phase. Moving to the introduction, assessing the health status is a major component of nursing care. And if good nursing care entails meeting the needs of the client, then these needs must first be identified. As such, the skills of observation becomes an invaluable asset. Assessment technique is therefore a skill that nurses must develop right from the very beginning of their training. Diagnosis should precede treatment whenever possible. Therefore, this study session focuses on the purpose, components, and techniques related to the health history and physical examination. At the end of this study session, you should be able to describe nursing assessment with its purpose. You should be able to define data collection and its processes. You should be able to explain the various components of health and nursing history. You should be able to highlight and explain the various techniques of physical examination. Nursing assessment. Nursing assessment is the first stage of the nursing process, like I've said earlier on. It involves you as a nurse carrying out a complete and holistic nursing assessment for every patient's needs, regardless of the reason for the encounter. The purpose of this stage is to identify the patient's nursing problems. So nursing assessment involves gathering of information about a patient's physiological, psychological, sociological, and spiritual status. We have different kinds of assessments. We have comprehensive assessment, we have focus assessment, and we have ongoing assessment. The comprehensive assessment is usually collected upon admission to a healthcare agency. It includes a complete health history to determine the current needs of the client, and this database provides a baseline against which changes in the client's health status can be measured and should include assessment of physical and psychosocial aspects of the client's health, the client's perception of health, the presence of health risk factors, and the client's coping patterns. Focus assessment is limited in scope in order to focus on a particular need or healthcare problem or potential healthcare risk. It is often used in healthcare agencies in which short stays are anticipated, like the emergency department, in specialty areas such as labor and delivery, and in mental health settings too. And then we have ongoing assessment, which is a continuous, systematic and reassessment or evaluation of a client's status with revision of care plan. This type of assessment allows the nurse to broaden the database or to confirm the validity of the data obtained during the initial assessment and to measure the effectiveness of nursing intervention. What are the indications for health assessment? Health assessment helps to collect data about the client through observation, interview, and physical examination. It helps to assess the patient's current physical condition. It helps to establish a database for future comparisons. It continuously updates database of the client. It also helps to detect early signs of developing health problems. It evaluates responses to medical and nursing interventions, and it helps to make clinical judgment about a client's changing health status and management. Let's go into data collection. It's the process of gathering information about the client's health status. It must be both systematic and continuous to prevent omissions of significant data and reflect a client's changing health status. We can have an objective data and we can have subjective data. Objective data is also referred to as signs or overt data. They are factual, measurable, and observable information about the patient and his overall state of health. That is, these are the things that you can see, you can hear, you can feel, you can smell, and they can be obtained by observation or physical examination. Examples of this include vital signs, height, weight, urine color, volume and odor, skin rashes, and etc. The subjective data is sometimes called covert data, and they are collected. They are data that cannot be empirically validated. It encompasses patients' opinion or feelings, client sensation, clients' values and beliefs, and perceptions of personal health status and life situation. For instance, only the patient can tell you he or she is afraid or has pain or experiencing itching. It cannot be seen. What are the methods that we can use to collect data? Observation. Observation can be visual, tactile, and olfactory. We can use the method of interview too, which can be directive or non-directive. And also we can use physical examination method, which include inspection, percussion, palpation, and auscultation. What are the guidelines for effective interview or history taking? The first thing is for you to be prepared. You have to be prepared for what you want to do. The interview is more productive if the nurse has an opportunity to prepare for the interaction. Such preparations include the review of client's clinical record, conversation with other healthcare personnel, and literatures about client's health problem. This will focus the interview and prevent tiring the client by asking unnecessary questions, and it will save your time. Then appropriate timing. Schedule interviews with clients at a time when the client is physically comfortable and free of pain, and when interruptions by friends, family, and other health professionals are at the minimal level. Also, you create a pleasant interviewing atmosphere. A pleasant atmosphere is created by a quiet, well-lit, well-ventilated, and relaxed setting, relatively devoid of noise and interruptions. With all this enhances communication. A relaxed atmosphere eases the patient's anxiety. It promotes comfort and convey your willingness to listen. Then you ensure privacy, as some clients will not share personal information if they suspect others can overhear. In all instances, the client should be made to feel comfortable and unhurried. Then you establish good rapport. You greet the client by name if possible. You sit and chat with the client and before the interview, and be sure to explain the purpose of the interview and show concern for the patient's story. Set the tone and be focused. You encourage the client to talk about his chief complaint. This helps you to focus on the most troublesome symptoms. You keep the interview formal while still being professional. Speak clearly and simply. Avoid medical jargons, and be sure patient understands what you are saying. Choose your word carefully. Ask open-ended questions to encourage the client to provide complete and pertinent information. Then take notes. Avoid documenting everything during the interview, but make sure you jot down important information such as dates and times. Health history and nursing history. A health history is designed to collect data to be used primarily by the physician to diagnose a health problem, and it is usually collected by the medical team. Often, the admitting nurse also collects this same information during the admission interview. However, there is a growing disapproval of the nurse repeating this process, as credibility is lost when the nurse repeats virtually all the questions that others have asked already. A nursing history has a different focus, which is the client's response to the health problems, and it assists the nurse more accurately in identifying nursing diagnosis, while the health history concentrates on symptoms and progression of the disease. The nursing history focuses on the client's functional patterns, responses to changes in health status, and alterations in lifestyle. What are the components of health history? In complete health history must contain biographical data, reason for seeking care, history of present illness, past health history, accident and injuries, hospitalizations and operations, family history, the review of the systems, the functional assessment, and the perception of health. In taking health history, it is neither possible nor desirable to tie a patient down to a particular sequence. The client must be allowed to tell his own story. Besides, a good clinician begins the examination of the patient as the latter walks into the room. his appearance, the way he talks, the way he answers questions, and so on, and only finishes taking the history when the consultation is over. Nursing history. The format that is usually used in nursing history is in most settings is the 11 functional patterns credited to Gordon, and this format allows systematic data gathering and facilitates making inferences, which is the nursing diagnosis. The 11 functional patterns that is credited to Gordon consist of health perception, health management pattern, the nutritional metabolic pattern, elimination pattern, activity exercise pattern, the sleep rest pattern, self-perception, cognitive perceptual pattern, the role relationship pattern, sexuality reproductive pattern, coping stress tolerance pattern, value belief pattern. Moving to the physical examination. Physical examination is a systematic examination of the body structures, and the examination may be done usually using a cephalocaudal approach, that is from head to toe, or the body system approach. There are some techniques that are used in physical examination. These techniques involves inspection, percussion, palpation, and auscultation. Inspection involves a deliberate, purposeful, and systematic observation to identify deviation from normal. And percussion involves striking or tapping a particular part of the body to produce vibrating sounds. The quality of sound aids in determining the location, the size, and density of underlying structures. Palpation. Palpation is an assessment technique that uses the sense of feeling and pressure to assess the structure size, placement, texture, temperature, distension, mobility, pulsation, and tenderness. We can have light palpation and it can be deep palpation. The light palpation usually involves the use of pads or fingertips, the dorsum, that is the back of the hand, or the palm, which it is used because their concentration of nerve endings makes them highly sensitive to tactile discrimination. We can have the deep palpation, which is done with the two hands, which is the bimanual palpation, like the one you are seeing on your screen. In the deep palpation, the hand is held flat and relaxed and molded to the body surface, as in the light palpation. Palpation forms the most important of abdominal examination. You tell the patient to relax as best as he or she can do, to breathe quietly in, and by doing that you'll be able to palpate gently and easily. You inquire for the site of any pain and you come to this region at last. Auscultation is the last technique of physical examination, which is an assessment technique that involves listening to sounds created in body organs to detect variations from normal. Some sounds can be heard with unassisted ear, but most sounds are heard through a stethoscope. To auscultate effectively, therefore, requires good hearing acuity, a good stethoscope, and knowledge of how to use the stethoscope correctly. Thanks for listening. Bye for now.